Hello, are you someone who's worried about large arms, flabby arms? You're looking for a treatment for this, but you don't know quite to do. You're researching online, there seem to be so many options, it's all confusing. Let us simplify this. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore, and today we will talk about how to get rid of sagging arms. Now, what is the issue here? A lot of people have what are known as flabby arms. Arms can be flabby for two reasons. One is if you have some extra fat. If you have fat deposits in your body, then chances are that you have fat deposits here as well, and that adds to the volume. Secondly, you might have extra skin. Extra skin is where you might have lost some weight and the fat has gone away, but the skin is still left behind. Now, different people can have different proportions of this. Typically, there's an issue of both fat and skin, but the severity of each of these can vary. In some patients, they might have a lot of fat which is filling out that skin. In other patients, there might not be much fat, it might just be empty skin. Either way, what this causes is that you have these flabby arms which are also known as bat arms, and that is a problem for patients, particularly women. They are unable to wear sleeveless dresses because they are worried of how that fat and that skin will be seen. When they are moving or doing work, or when they are working out or when they are exercising, that fat might be moving around and flapping around, and it might feel very, very uncomfortable. Now, how do we treat this? Typically, there are a couple of options. The first option is to do something called an arm lift. This is where we are removing a piece of tissue, skin and fat in that area, and we are stitching it. This leaves a thin scar in that area. This is typically better when the main issue is a lot of extra skin. Obviously, the problem is that long scar. This scar heals well in Western patients, as you can see here. But in a lot of Indian patients, this scar is not acceptable. Particularly if you're going to wear a sari where that arm is visible, then this is not an acceptable trade-off. So what is the other option? The other option is to do something called liposuction. That's where we make a few small holes and we suck out the fat in that area. So here there's no major scar, there's just a few small holes and we're removing the fat. Now this works better when the main issue is fat and there isn't a lot of loose flabby skin. In this situation, what happens? You're left over with some extra skin. So you're avoiding a scar, but there's still some extra skin left over. This is not an ideal treatment. So is there a solution? Is there a way that we can remove the fat and help tighten up that skin without giving a big scar? Thankfully, recently there has been an advance where this is possible. At the Venkat Center, we have this machine called Body Tight, which is a skin tightening device. Through these same small holes, we introduce the Body Tight probe. And what that does is, it produces radio frequency energy which heats the inside of the skin. And this stimulates the skin to shrink and tighten. So here, we're able to get skin retraction and contraction and get rid of some of that extra skin without giving a very big scar. Now, how is this procedure done? Well, unlike other places, we do it under local anesthetic. So, we do some blood tests, you pick a date, you come, get it done, go home the same day. There's no admission or anything. We give anesthesia in that area where we are operating. You are fully awake during the surgery. You're able to walk and move around, and this makes the surgery very, very safe. You're avoiding all the risks of general anesthetic. Then once the anesthesia is given, we make some small holes. Through those holes, we suck out the fat. And we use the Body Tight machine to shrink the skin. After the procedure, we give a tight bandage which is there for 2 days. So after the surgery, you need to come for 2 days to get that bandage changed. Now, how are the results? You see a noticeable improvement within a couple of days itself in terms of the size reducing. But it can look a little wrinkly, it can look a little irregular. For it to fully shrink and tighten and for the full result to happen, that process typically takes around 3 months. You see most of the result in 1 month, but full result takes 3 months. You can see some of our results in the upcoming slides. Now, as you can see, this works very, very well. For most patients, it helps get rid of that extra skin. But I must warn you, this is not a replacement for an arm lift. It cannot do the same result that an arm lift does. In an arm lift, we're literally removing a huge chunk of skin and stitching it. This cannot replace that. But most patients don't have so much flabby skin. So for most patients who have fat and some flabby skin, this works very, very well. A lot of our patients who are candidates for arm lift also still prefer this because they don't mind living with a little bit of extra skin, but they don't want to have that large scar on their arm. So this is a very, very good solution. Now, are there any risks to this procedure? This procedure is very, very safe provided it is done correctly. Firstly, by doing it under local anesthesia, you're removing a lot of the risks associated with liposuction in general. Now, specific to the arms, there is an area where liposuction cannot be done because there are important blood vessels and nerves moving in that area. And it's important that that area is not breached during the surgery, and that is something we take care of. So, make sure you get this procedure done only by someone who knows what they're doing, who have experience in arm liposuction in particular. It is not something that any Tom, Dick and Harry can do. I hope you liked this video. If you have any doubts and questions, do reach out to us. You can watch our other videos on liposuction under local anesthesia as well as body tight to understand more. Do like, share and subscribe. Thank you. Have a great day.